Hi, welcome to my video presentation. So I will talk about neurodevelopmental disorder, this is my assignment 1, breaking the silence to systemize mental disorders, which my topic is learning disorders. Let me introduce myself first. My name is Charlene Puraimalang. My matrix number is D202311068444. Do you know what is learning disorders? Learning disorders is a learning disabilities are disorders that affect the ability to understand or use spoken or written language. Child may have problems with reading, mathematics, or writing. Skills are below what's expected for the child's age, grade level, and intelligence. The problem is bad enough to interfere with school or everyday activities. Let's proceed. Next, in learning disorders, there are many types of disorders. I will explain about 5 most common learning disorders, which is dyslexia, ADHD, dyscalculia, dysgraphia, and dyspraxia. What is dyslexia? Dyslexia is a learning disability that makes reading and language-related tasks harder. It happens because of disruption in how your brain processes writing so you can understand it. Most people learn to have dyslexia during childhood, and it's typically a lifelong issue. This form of dyslexia is also known as developmental dyslexia. Third point is dyscalculia. Dyscalculia is a learning disorder that affects a person's ability to understand number-based information and maths. People who have dyscalculia struggle with numbers and mathematics because their brains don't process math-related concepts like the brains of people without this disorder. However, their struggles don't mean they are less intelligent or less capable than people who don't have dyscalculia. The symptoms of this disorder usually appear in childhood, especially when children learn how to do basic math. However, many adults have dyscalculia and then don't know. People who have dyscalculia often face mental health issues when they have to do maths, such as anxiety, depression, and other difficult feelings. How about dysgraphia? Dysgraphia is a neurological condition in which someone has difficulty turning their thoughts into written language for their age and ability to think, despite exposure to adequate instruction and education. Dysgraphia can present with many different symptoms at different ages. It's considered a learning difference. Writing is a complex process involving many skills and brain functions, including fine motor skills, ability to perceive the space around you, ability to form and manipulate information in your minds, and ability to form, store, and recall letters, numbers, and symbols. The last point is dyspraxia. Dyspraxia, also known as developmental coordination disorder, which is DCD, is a chronic condition that begins in childhood that causes difficulties with motor movement skills and coordination. Dyspraxia can cause a wide range of issues with movement and coordination. Some of these may be noticeable at any early age, while others may only become obvious as your child gets older. Dyspraxia can affect your child's coordination skills, which can make riding a bicycle or playing sport difficult. It can also affect the fine motor skill, such as writing or fastening their shirt buttons. How about prevalence of learning disorders? There is an estimate 5 to 15% of school-age children struggle with a learning disability, and estimate 80% of those with learning disorders have an impairment in reading, in particularly commonly referred to as dyslexia. Dyslexia is common, affecting 20% of the population. Dyslexia affects male and female equally. So, what is the causes and risk factor for learning disorder? Learning disorder happen because of a problem in the nervous system. The problem may be in the brain structure, or the chemical in the brain may not work right. As a result, a child with a learning disorder receives, processes, or communicates information in a different way. Also, differences in the neurological functioning of the person's brain. These differences can occur before the person is born, during their birth, or in early childhood, and may be caused by factors such as maternal illness during pregnancy, birth complications that block the flow of oxygen to the baby's brain, injury of illness such as meningitis in early childhood, certain genes that can make the person more genetically predisposed to developing a learning disability, and health conditions such as cerebral palsy and Down syndrome often involve some extent of learning disability. What is the sign of learning disorders? There are common signs that a person may have learning disabilities include the problems reading or writing, problem with mathematics, as I shared just now, poor memory, problem paying attention, trouble following directions, clumsiness, trouble telling times, and problems staying organized. For the intervention, how is a learning disorder treated in a child? Treatment will depend on how child's symptoms, age, and general health. It will also depend on how severe the condition is. Parents, teachers, and mental health experts work together to help children. Treatments may include individual or group classes, which is we talk about your problem, share it if you don't mind. And special classes or resources, look for friends, attend any club or extra activities at school. And next is speech therapy, on how to monitor the child condition and progression about how far your children go.